One of the things that makes Signature Healthcare revolutionary is our Department of Spirituality. It's the opportunity that we have as chaplains to serve our community. We're able to serve a diverse culture, whether it's a religious belief or a religious practice. We're able to meet that need because we are connected with the religious bodies within our community as well as without of our communities, so that we can actually go into our residents or our families' lives and be able to minister to them and provide for them not only the emotional need and security that they need, but also to be able to provide spiritually, whether it is a practice or even a ritual. We're able to meet the diverse needs of each of our residents because our residents do have unique practices or cultures that they come from, and the chaplains program is able to meet that need where they're at. And we're able to do that by using and utilizing other sources of faith. It's an interfaith program, non-denominational in reach, so that we can minister to the needs, the heart, and the soul of each and every one of our residents. One of the unique things about the chaplain program in the Department of Spirituality with Signature Healthcare is the fact that the goal, which has been met, is to have a full-time paid chaplain in each facility so that they can minister to that community. So the utilization of volunteers in a supervisory role is not necessary. We train, we educate, and we recruit our own chaplains from that community, from that culture, so that they know who to contact. They have roots within that community so that they can minister and be able to serve their communities in the best, most efficient way. We also, as part of the full-time chaplains, we are there throughout each day. We are on call if needed, and we provide that service as part of not only the outreach to our residents, but also to their families and also to the community at large of our stakeholders. Because not only do we realize that the need of our residents is great, diverse, and unique, so is our stakeholders. And they have spiritual needs and emotional needs that need to be met, and a full-time chaplain being in that community daily will learn the intricacies of their lives, the needs that they have, and we're better able to offer resources and opportunities to meet whatever need, whether it is a stakeholder, a family member, or one of our residents in our communities. One of the responsibilities of our chaplain program is that of visiting our residents. Not only are we involved in group activities through our Quality of Life program with each and every one of our residents, we also do one-on-one visits where we will visit the resident in their room. Maybe we will visit them in therapy as they are participating in their own health and well-being, or even on the floor during the day. We will stop and visit, offer prayer, offer support, offer a resource for them to be able to share their need, whether it's a spiritual need, a physical need, or even an emotional need, because we also want to be able to encourage our residents through their day-to-day life. And by doing that, by being available full-time, we're able to reach out daily to see their need. And we partner very closely with our Quality of Life program, as well as volunteers and other ministries and individuals from social groups, civic groups, and church groups, so that when we can't be available during the day-to-day operations of the chaplains program, others are there to meet the social, spiritual, and emotional needs, working under the auspice of the chaplains program, so that our residents' needs are met, so that they're validated, and so that we're able to keep that close connection of community within our building. One of the unique benefits of a chaplain's program in our community is that of a bereavement program. It began about 4 years ago when I started working with the community. We began to realize that as a resident would pass away, whether they were in our community at that time or maybe even had been discharged to their home, that oftentimes not much was done for the family and to reach their needs. One of the things we began in the bereavement program was a contact with that family. I will attend the funeral, if at all possible, of every resident that passes away, or at least go to the visitation or to the wake of that individual. In addition to being there as a presence ministry for the family, also follow that family for 1 year past the death of their loved one. And we do that so that we want them to realize their loved one meant something to us as well. We're not just a institution or an organization, we're a community. And we love their loved one, and we cared for them, and we want to care for them in much the same fashion. So one of the aspects of our bereavement program is that periodically, from the time of the death of the loved one, I will send letters, I will make phone calls, even visit if that is advantageous to the individual family members, them to offer comfort and resources. I will send out letters and booklets, offer seminars to those individuals. So if they have some trouble readjusting or recovering through that grief and period of bereavement, we're there to help. We also started a grief group through our local community that is offered off-site so that the community, the family members, our stakeholders, or even other residents are able to attend. And it's a peer-led support group where they're able to go for a period of 9 weeks. We teach them about loss and grief, how to deal with that, how to adjust from it, and how to be able to help other people. So the Chaplain's program is multifaceted in the fact that not only once a resident passes are they cared for, but even for the extent past that we want to make sure that they realize that we are the community of choice and that we do care, and we offer that in many of the resources through the Department of Spirituality. In addition to many of the services the Chaplain's program provides, we also partner with many other ministries, individuals, and volunteers, as well as groups that will come into our facility to minister or to visit with our residents within that community. We schedule a church service each Sunday afternoon, and those services represent the broad and diverse cultures and faiths of the residents that are in our community, so that everyone will have some type of connection with the faith group or the faith practice to which they came from prior to entering our community. But in addition to that, throughout the week, there are a number of services that are scheduled. Some may be singing groups will come in and sing some of the old hymns or some of the more cultural songs that people are used to. We'll also have individuals that will come in and do a preaching service. There are Bible studies, there are prayer services, there are rosary services, and different types of services to meet the practices and the rituals of each and every one of our residents within that community. So part of the Chaplain's program is not only to be there full-time, but also to make sure that we're reaching out to our community, reaching out beyond our communities, and bringing people into our community so that they are able to serve our residents and to make sure that the broad needs of the human body is met. Again, whether it be a spiritual need, an emotional need, a physical need, or a social need, we want to do everything we can to plan for and to provide those outlets. So on a given week, we probably would schedule between 4 to 6 different types of events daily so that we would be able to see each of those needs met. If we have an individual from a culture or from a practice or a faith background that is not currently represented, as the chaplain, it is my responsibility to go into the community or out from our community and find people that can meet that need, bring them into our community so then they can minister or reach to that resident. We really want to have resident-centered living in all that we do so that we can not only reach out to the body through the nursing programs, reach out through the emotions through our quality of life program, but also reach that spiritual need and make a connection with our residents in that community that choose to do so.